Let me turn the other way. OK, darling?
Meet Norman and Ros.
They'll say to you, 85% of the people that get this live a normal life, relatively normal life. Yeah? And that's all right if you're in the 85%. But poor old Ozzy has never been.
Once a well-paid project manager, Norman took early retirement to care for his wife, who lives with multiple sclerosis and dementia.
I always got the work done, but then it went a bit pear-shaped, and and then, as I say, I collapsed in the street. How's your foot?
But the Hertfordshire couple found help hard to come by and were forced to sell their home to pay for care.
My kids learned a long time ago that their inheritance has gone, right? Because we don't have any money left. Yeah, we didn't have any money left a while back.
While Ros now receives care at home, others will go into facilities like this one in Norfolk. Docking House looks after dementia patients who have the highest level of dependency. After COVID, a lack of staff meant 30% of the beds here lay empty. Like much of the sector, it relies on overseas labour. Those here say more money and higher wages are needed.
We've got to reward them, and we don't, and we can't, simply because the funding isn't there for local authorities. What amazes me is that we've got a government in power that's been there for 14 years and not been able to tackle social care. We've got an opposition that has never really challenged why social care has never been taken care of.
In many ways, the crisis in social care taps into broader themes of the election. There's the sense of apathy caused by politicians repeatedly making promises and not keeping them. And then this is just another sector depended on by many that quite simply at the moment isn't able to function as it should. The economist Sir Andrew Dilnot chaired a commission to try and fix that, but 13 years on, his plan still hasn't been put into action.
Politicians are reluctant to talk about it, first because they're worried about anything that means an increase in public spending and therefore possibly taxation. It's a shame not to hear about this. This is the biggest risk that isn't managed that all of us face. 4 out of 5 people are going to need social care before they die. We should grow up and face it.
I'll take the ironing over and get him dry.
Back in Hertfordshire, Norman also wants politicians to step up.
Throwing money at the NHS won't solve it. They've got 6 million of us unpaid carers, right? If they help us, we can help the system, right? But as what's happened to me, where the system just kept backing away, until I cracked.
One story among many.
Despite all the ups and downs, you keep going. You keep shocking the doctors.
As this couple takes each day as it comes.
We keep pegging on, don't we?
Here we do.
Yeah, every day.
Every day.
Rob Powell, Sky News in Hertfordshire.